think they just love themselves in general.
Yeah.
And they just, essentially their shit doesn't stink. You know what I mean?
Yeah.
You agree?
I know exactly who you're talking about. And if we can just circle back to the scrubs around the biceps, I do think I'm convinced, like tailor them that way.
Grab a coffee, take a breath. You've just clocked into the ER Edit.
I'm Caitlin.
I'm Carly.
You are now clocked in. Welcome back, you guys. We are on episode 8. How did we get here? I can't believe it.
We're almost double digits.
I know. But we are excited to be back. This episode is going to be so good.
So good.
We see all the time on TikTok and like other social media platforms and stuff like that. But there are so many different nursing stereotypes that go around. And some of them are so hilarious because they're so accurate.
And it's so funny to see like who they're by. You know what I
Yes.
mean? Like other nurses doing nurse stereotypes are hilarious.
Yeah.
But then also people that are non-healthcare doing it.
My favorite.
And then it's like just nurses in general and then breaking it down to like nurse specialty stereotypes.
Yes.
I could talk about this all day.
I'm here for all of them. Let's just jump right in.
So I know when we started our podcast, like day 1, episode 1, we talked a lot about like what's the obsession with nurses, how people perceive nurses.
Mm-hmm.
And so we like kind of talked about this, but I think that there's like 2 pieces to this.
Okay.
Like as a nurse, what do you think some of the main like big top stereotypes are just of nurses in general?
Okay. So I think generalized nursing is there's always like an OG nurse. This is like your baby boomer nurse that's been around since the dinosaurs,
Like
right?
the old school Cherokee scrubs.
Oh my gosh. She's got,
Still take smoke breaks.
yes, New Balance sneakers on, like the old school New Balance.
Not like the cute ones.
Nope. But also she secretly runs the department without being in charge.
Oh, yeah.
You know what I mean? Because she's already taken a step back from being charged.
She's not going to take a charge role because she's fed up with the politics.
She's also smarter than that. Being
Yeah.
a charge nurse sucks.
That's
and she's
right.
probably done her dues.
Yeah.
But this is also the nurse that everybody runs to with their questions.
This is the nurse that can calculate a drip rate.
Just by sight. I mean, like
Yes.
we are just quickly,
Yeah.
and it's like nail on the head.
Right.
This is Erica to me.
Oh, yeah. Yep. Yep.
And she is the mom. She is the mother hen of all of
Yeah.
us, secretly deep down.
But also, like, don't cross. Do not cross the OG nurse mom.
Not ever. And this is also someone, if you get on their bad side, you're never back on. You're never back on.
You won't recover.
No, and they'll remember everything forever. But the funnest thing to me about these OG nurses is like when you look back on it, this is also someone's mom that you like get to hang out with all day at work.
Yes.
And
Like,
I don't know.
You're 22 years old and you're like, my best friend is
Yes.
like a 50-year-old woman.
But I also don't think that their kids know how cool they are.
Oh, for sure not.
I'm like, I wish you could.
Maybe when they get older.
Yeah.
But like if they have kids that are like high school.
They have no
They have no
idea.
idea.
And their mom's a rager. Like she's a good time.
Mm-hmm.
The second one that I would say would be the male nurse.
That's a great one.
There's 2 different caveats to this, in my opinion. Don't you think?
Like 2 different kinds of male nurses.
Mhm.
Nurses.
if you will.
There are definitely different types of male nurses.
Mm-hmm.
For sure.
So I have like 2.
Okay.
I have the jacked, scrubs are too tight around the arms, loves themselves, posts about themselves,
Like,
all of the
about
things.
being a nurse, or just like they love themselves in general?
I think they just love themselves in general.
Yeah.
And they just, essentially their shit doesn't stink. You know what I mean?
Yeah.
You agree?
I know exactly who you're talking about. And if we can just circle back to the scrubs around the biceps, I do think I'm convinced, like tailor them that way.
How do you say it?
Do you know?
100%.
I'm like, did you stitch that?
That was not made that way.
No.
Oh my gosh, you're right.
Yeah.
You're right. Okay, so there's that one. The second male nurse that there is the male nurse that sits in a group full of girls, and we are all best friends.
And he's a girl's girl.
A girl's girl through and through. Actually, the dude nurse on TikTok. Do you follow him?
Yes, I love
I
him.
love him. I actually really want him to be on the podcast. If you guys don't, go give him a follow and tell him that we sent you. He'll be so excited. But he posted something that I actually sent to ours. Did you see it?
The girly pop?
Yes.
Yes.
And it's my favorite because there is always, I think, a guy that gets adopted by the girls as the little brother, big brother, whatever it may be. Let me just tell you, I think that these guys have really figured it out.
Well, they're smart.
That's
they
exactly
are
it.
smart.
That is exactly it. They have figured out the exact group of people that are always going to protect them, first of all. Secondly, they know all of the tea in the department.
Oh, yeah. And honestly, sometimes they are bringing the tea. And I'm like, how do you know this?
Oh, most of the time.
Yeah,
Because they're trusted
that's true.
with it.
I would argue there's a third type of male
Ooh,
nurse.
I'm ready.
I'm picturing the ICU male nurse who's like retired vet.
Yeah.
Works overtime 7 days a week.
Uh-huh.
Wears the same outfit multiple nights in a row.
Yep. Has their like army pendant necklace on all the time. And it's like tucked in, but you can kind of like see the glimmer of it.
Yeah, is like salt and pepper hair.
Yes.
Is like old enough, like should retire, but like won't because they like love to work.
Well,
Do you
this
know
is
what
their
I'm talking
identity.
about? Yeah, like that type of nurse. And they're always in the ICU.
They're always in the ICU. They never really talk much. Like they're
No.
very quiet on the department. You can't ever get a read on if they like you or not.
Yeah, I'm also like, are you really smart?
Yeah,
Or
what
do you
is
just
it?
like get by? You know what I mean?
You never
What
know.
I'm saying? You don't know.
You can never figure those ones out.
Yeah.
That is very true. That is very true.
They're not in the ER as often. I don't feel like we brush shoulders with them as much because that personality doesn't really like that I don't know. Maybe they are. I
No.
feel like I don't see them in the ER.
No, I don't think they fit well in the ER.
But they are in the ICU.
They are in the ICU, and I think that truly that's where they belong. There's a singular nurse for every department that's necessary in that department, and I think that one is.
Girly pop nurse though and GI Joe nurse, those two men, they are in the ER.
Every single time. G.I. Joe nurse. The girly pop nurse is my favorite.
I know.
Hands down. Okay. Third. What's your third?
Okay, this is like one of my favorite ones on TikTok.
Okay.
The Gen Z nurses.
Oh, yes.
And I love me some Gen Z nurses.
I know.
I'm a millennial.
Same.
But the TikToks about the stereotypes with Gen Z, like I think Nurse Flake does one a lot where he has like the big star, like oversized star, like zit pimple thing on his face, like, or the slang.
All the slang.
Like the slang, the way that Gen Z would talk to their patients or to the doctors when they page them. I die every time.
Well, and it's like the typical uniform that they have on. You know exactly what they're going to be wearing. Even like I think Nurse Blake packed their lunch and it was like something like there was a Lonnie in there. There was like all of the TikTok-y things on there that they have and their badge clips and all of that stuff. I love a Gen Z nurse.
I know.
I like love working with them.
I know.
They're a good time. And I feel like they bring, honestly, so much vocabulary to my life that I feel cooler when I get home to talk to my kids.
Yeah.
Even though sometimes they're a little mortified by the things I say, but I learn it from them.
Yeah.
I love it.
I feel like now being out of the ER, I don't work with as many Gen Z in the PACU because I think the PACU, like you have to have typically experience.
Mm-hmm.
So a lot of the PACU nurses are ICU or ER nurses that come over. So you're not getting a lot of like fresh out of nursing school, young nurses there.
The PACU nurses are the smart nurses that have learned that they don't need to live in a life full of adrenaline.
Listen, the nurses over in PACU,
They're OGs.
There's a lot of years of experience.
Yes.
And I think there's a lot of intelligent nurses that just learn, you know what?
I don't have to work that hard.
We make the same paycheck for a lot less liability and
Truly, the
working less.
PACU nurses and the ASU nurses have it figured out.
We do. But I think that we don't see, like, I don't work with many Gen Z anymore. And I do kind of miss that because I do feel like there's like a lightness to it.
Oh my gosh, we have two now, and I will like look at the things that they wear and be like, noted. I'll add that to the shopping
Like
cart.
what's in right now, like for nurse attire with Gen Z?
Okay, well, the new fig scrubs that they have that are like, they're almost like a workout material. Have you felt these?
No, but I am happy to hear that because I have a bone to pick with figs a little bit. They're so stiff.
Okay.
So I have not felt their new ones.
Immediately add to cart. It is like this butter. Okay, you know those long sleeve shirts that you can buy? Like they used to have them at Nordstrom and stuff. But like when you touch them, let me touch it. It is like almost that material.
Is it a scrub top though, or is it like a long sleeve fitted shirt?
No,
like
it's
an undershirt.
It's a scrub top and scrub pants to go with it. And so you're literally wearing workout leggings to work.
I do feel like that's like a new thing though, that I've been seeing just in general is like kind of a fad with scrubs right now is like a bell bottom like fitted legging.
I love a wide leg scrub.
Me too.
I'm so glad that they came back because we were wearing joggers.
I hope that doesn't. Well, joggers were big.
They were huge.
Like,
I was
I
proud
wore them
to
for
get them.
years. I have so many joggers in my closet,
Same.
and then I put some on the other day, and I was like, "Oh my god!"
Well, hello, camel toe.
Well, and as somebody who's 5'3", I was like, "Why did I ever think this was flattering on my body size?"
Give me the wide leg, but these ones are like a fit to flare, kind of. Some are wide leg, but I'm just telling you that material, that's what's in right now.
Look at us talking about
my
what's
gosh.
in.
Figs, we love you.
Figured it out.
We need this.
They figured it out then. I will
Oh
give them
my
that.
gosh. Okay, so there's that. But then there's also like shoes that they wear, jewelry pieces that they wear. I'm like, you guys are so cute. You're so cute.
I don't know if I ever like got. I mean, I'll do my hair and makeup sometimes, but like even as a new nurse, like I never like wore jewelry.
Oh, they have it all.
I'm afraid of people ripping my earrings out.
Yeah. I'll wear small earrings to work, like even like a small little hoop, but
Yeah.
like to wear something like this, no, your earlobe's about to get fucked up.
You're about to get sliced.
Yeah, not happening. So I love,
Okay, what right now? Because again, I don't work with many Gen Z. Like, what is like the slang?
okay. Well, I have heard a Gen Z nurse say, take a beat. Like,
Is that a new saying?
well, I haven't heard it recently. Indy says it.
I feel like I've been saying that, and I wonder if I subconsciously have heard it like on TikTok. Look at me being influenced.
I think you have.
Scary.
Because Indy says that. So they'll like look at the patients and be like, do you need to take a beat? And I'm like, well,
Those
what?
those are fighting words to me.
Well, and I think they say it more of like you need a minute by yourself, like kind
Yeah,
of a thing.
yeah.
You need to take a beat. And I'm like, oh, okay, like noted. We're doing that.
Okay.
What else do they say? What were some of the other slang words here recently?
It's giving.
It's giving. They say
Slay.
that.
Is that still a thing?
They don't, I've never heard that in the hospital, but they do say like it's giving sepsis. Like they'll say that to us. Like it's giving UTI. It's giving, yeah, which I love deep down because I'm like, you're right. It is giving
I do
UTI.
love that. It's giving. What was that thing that doctor said? It's not giving.
It's not giving. So they're just like a good time. I feel like they bring like a light
a
and
youthful.
airy.
Yeah.
It's fun.
As long as it's followed up with like competency. Like I can, you know what I mean? Like if you have that, but it's like you're also not competent, like now I'm just annoyed. Like you're fucking pissing me off.
That's valid. That's very, very valid. What about the know-it-all nurse?
Yeah. So the know-it-all nurse is a hard no.
Mm-hmm.
Hard no. And the know-it-all nurse can be a new grad. It can also be
Yeah.
like a veteran nurse.
The problem that I have with the know-it-all nurse is that they typically don't know it all.
Well, no, they don't.
And they're fighting
the
you over
nurses
things.
that actually know it all actually are like those quiet
Yeah,
nurses.
100%.
And they're the ones that like know everything. They
Mhm.
show up. They're always reliable.
Mhm.
But the ones that are vocal know-it-alls, they are not usually know-it-alls. They're also scary sometimes.
Yes.
Because they're not going to ask questions. They're just going to present like they know and they don't. That's
is-
scary.
and they won't take the time to look everything up. So like even just my last shift that I worked, there was a medication ordered. And in my mind, I was like, what the hell is this? Like I have never heard of this med before. So of course, just like anybody else would do, I immediately run to LexiComp because I'm like, I need to figure out what this
What
is
was
and
it?
why I'm giving it. I can't even remember. It was a name.
Was it a pill?
It was a pill. It was a name that I had never heard before. And it was for like chronic kidney disease, but
Okay.
I hadn't ever seen it before.
Yeah.
And so I went and looked it up and stuff like that. But those are the times where it's like, how many people are giving things that
Just
they
because
have?
it's ordered.
Yes. And you don't know if it has interactions with anything else or if that's the correct dose or whatever it may be. And so it's like scary when you think about that
Well,
stuff.
anyone, I mean, this is nursing 101. Like if you're going to administer medication, you need to know what it's for and
Yes.
like what the side effects are or what could
Every
go
time.
wrong.
Every time. If you don't know it, look it up.
And I think when you work in somewhere like the ER, we're not usually giving like home medications. Like we're usually giving, protocols. We're following things. We're giving like the same medications a lot, usually, right? Enough that you know what you're giving for the most part. But every once in a while you get these holds. You're giving meds you're not familiar with, or like you have a weird situation come up and you're like, I've never given that.
Yeah.
And so you
100%.
do need to look it up. But even outside of medications, like, have you ever worked with a nurse who just like goes in the room and does things and they're like, wait, what? They're like,
or when you're getting a report and they like tell you like, we've been doing this today or like whatever, I gave them this, and your eyes just become big because you're like, what? I had one time that I got a report from, and I don't remember why the patient was there necessarily, but they were getting antibiotics and they needed an antiviral at the same time. So they had antibiotics ordered and acyclovir. There was 2 different antibiotics and the acyclovir were all going at the same time, all into the same IV.
Oh, yikes.
Like piggybacks. And I walked in the room and was like, hold up, whole time. We need a timeout.
Yeah.
This is why you also go in the rooms and do bedside report.
And check everything out together. Yeah.
So the know-it-all nurse is a little scary. It's a little scary sometimes.
I would say, I think the nurse that's the scariest nurse is the nurse that doesn't ask questions and acts like they know everything. And when you read our medication errors segment, like some of these are insane. Like the amount of medications that are being pushed through IVs that are not IV medications, like juice, like anything, right? Those nurses that are doing that, like everybody makes mistakes, but instead of going, this seems odd, let me ask somebody, they're like, fuck it. It's ordered, I'm going to do it. That's scary. That is scary.
I think at the bottom, like at the end of the day, you have to realize that the doctors putting these orders in are humans too.
Mm-hmm.
So like we got to really reconsider what we're doing here.
Yeah.
So that's like generic nursing wise. But I think what about department wise?
Like specialties?
Yes.
Well, this is I think that nursing specialties definitely have stereotypes.
Absolutely.
I think people can always break the mold. Like I think you can find certain nurses that don't always fit the mold like in that department. But overall, I would say like you have ER nurses, ICU, Peds, NICU, like oncology, Psych. Like there's a reason people are drawn to those areas.
I love a psych nurse. So. Let me tell you what I think about a psych nurse.
Yeah.
This is the rough and tumble. They probably have tattoos. They may have been institutionalized at one point for themselves, which no hate. Like we probably all could have been there at one point in our lives. But they are here for a rodeo. Like I feel like they could lasso a bull if they needed to with no problem.
Yeah, and they'll have your back too, though.
Oh, they're ready to throw down.
But you know what? They're also really, really good at communicating with psych patients.
I'm telling you.
But they also are like no bullshitters. Mm-mm. But yeah, kind of rough around the edges.
Rough around the edges, but in the best way.
Yes.
Like they have to be in order to work in that environment. Otherwise, I think you'd go crazy.
Yeah, literally.
And then NICU.
I imagine NICU nurses either like the OG old ones who have been there forever and just like know everything, or like sweet 30-something-year-olds.
That's how I picture it too.
You know?
Mm-hmm. I even picture them maybe a little bit younger. Like maybe don't have kids themselves yet, but did really well in nursing school, like came out top of their class, really interested in learning and understanding everything.
Big hearts.
The empathy runs deep.
Thick.
Like these, when they clock in, these are their babies.
Mm-hmm.
That's how I picture it.
As it should be.
Absolutely.
I was not built like that.
No.
But that is how they should be. And that's how I imagine them to be. Okay, Peds.
I feel like Peds can go a handful of different ways.
Yeah.
I don't know that I have like a standard for a Peds nurse necessarily.
I feel like they're goofy.
Yeah.
They're goofy. Like they wear the printed scrub tops.
Oh, for sure. There's like cartoon characters on their scrub tops for sure. But like maybe I would too if I was a Peds nurse, if it made things like easier for the kid.
That's true.
But I kind of feel like a Peds nurse is like the grandmas of nursing.
Oh. You picture them like
older. Yeah. And like really kind of no bullshit, but full of love. too at the same time.
Full of love, but like doesn't take shit and like can not stand up, but like set a healthy boundary with like parents. Because that takes a skill that I feel like I wouldn't have.
No, I feel like the parents make or break a peds nurse's day.
Yeah.
And it is really difficult. I mean, we get peds in the ER and sometimes the parents are really challenging. And I think that is rough.
The parents are the hardest part sometimes of taking care of peds.
Oh, 100%. Hands down.
So in pediatrics, another like subsect, I guess, would be pediatric ICU or the PICU. And I did 2 days in the PICU when I was in nursing school. And I think that's what was like my first trauma as a nurse. So I was a student, what I saw. And the nurses in there, I was like, what the like, and I asked one of the nurses, how do you do this? And she did say to me, like, the average life expectancy, meaning like career for a PICU nurse is 2 to 5 years.
How can it be any longer?
I mean,
how can it be any longer with what you see?
Because the kids that are in there are sick or have had such bad trauma. Like, it's devastating. And in the one like case that I followed and saw, which was devastating, I was like, I don't know that I'm going to recover from this. And I've never forgotten it. And that's just part of their day. Like, talk about compartmentalizing.
I feel like PICU nurses need they are one of the nurses that need the most amount of therapy after they come out of that.
Yeah.
Especially, I don't know that you can be a peds nurse with having kids of your own. Like, I feel like...
I think a lot of them do,
I know, which is crazy because for myself, there would be no way.
Oh, me either.
I just wouldn't be able. They are real life angels, though, those PICU nurses, and they see and do so much. I also think that the PICU nurses, too, along with everything else, there isn't really like an age range that I can pinpoint.
No, I will say what I did notice about them, whatever age they were at, is they had a confidence about them. Like, they had their shit dialed in. And I'm not talking about the know-it-alls. I'm talking like they had
are the
experience.
legit.
They were legit. Yeah. And they had this confidence about what they did. And when they walked in the room and like, I have a lot of respect for them.
I kind of want to go shadow one now. Like, in my career now.
In nursing school?
I went one shift, but there wasn't like, I didn't get the hands-on experience like that. Like, it was more just like, here's what the PICU looks like and stuff like that. So I want to shift with them. Because wild. I think that they're badass.
They are.
Speaking of badass nurses, flight nurses.
I knew it.
Yep.
Okay, you tell me.
Oh my God, this is like my dream and you know it. I would be a flight nurse today if Nick would let me. But he keeps saying the kids are too young.
I don't know that your anxiety would handle that well, though, like when you're in it because of what you'd see.
Yeah.
And then like what could happen for me, I've always wanted to do flight nursing until I had it.
That's the problem.
And then you see like these helicopter crashes and stuff.
I know.
And I'm like, I would not risk that.
Well, and there was just one that went down not too long ago. Yeah. And it's not super far from where we were at. So it was like Nick and I both looked at each other on the couch. I'll remember it like it was yesterday. And he was like, I was supposed to go on a ride along that next week with one of our coworkers. And so
a helicopter ride along?
Uh-huh.
Oh.
And Nick was like, I can't.
I'm not comfortable.
I can't. And I have to respect that because obviously it would leave him here alone.
Yeah.
But flight nurses are fucking so amazing. They are badasses. So their training. So we had a friend that did the whole flight nurse training, and the stuff that they learn in there, I would just give anything for a day.
Yeah. It's impressive.
They can intubate patients. They can
like
dart
a space
chests.
that's like this big.
Mm-hmm.
Like, it is very impressive. Giving report to a flight nurse, though, like when they come in and pick up a trauma or they're dropping off a trauma, whatever, and you're like giving or getting a report from them, it's nerve-wracking.
It is. I feel like you hold them to a little bit of a higher standard, too.
And I also think that some of them have like this arrogance about them, not in a negative way, but they're just like so cool.
It's because they earned it.
They did earn it. And they're in like these like badass like
light
jumpsuits
suits.
and their ass looks phenomenal.
Yes.
And I'm like, and they're like, and it's like no matter what.
And the girls too always have their hair in these like gorgeous ass braids with this like thick like headband across. And I'm like, why do I have a crush on you right now?
I know.
Like, you took off your helmet and I felt some type of way.
I know.
And I am straight.
I know.
Girl, I like you today. And I think it's because you envy them, because you're just like, that is so fucking cool what you do. They're essentially able to do most things the doctors do in their tiny little closet of a helicopter.
Yeah, and they're usually up there with a medic, usually.
Yeah, so you can do medic and nurse, or they can do nurse and nurse transport, just depending.
And I have respect for all of them up there in the pilot.
Mm-hmm.
Like,
oh
that's
my God.
a crazy job. But I saw this skit the other day on TikTok about this, about like getting a report from a flight nurse, and the nurse, it was the same nurse like doing both sides of the skit. But it was so funny because it's like when it's you giving a report and they're asking like questions that you like should be prepared for and you are, but you're like, oh, I don't know. And they're like, it's fine. Don't worry about it. Let me look it up. Or I got it. Kind of, and you're just like, fuck, you know?
That has literally happened to me. Yeah. Yep. I feel all of it. You just get like nervous in the moment. I think it's just because you have so much respect for them.
Yeah. It's kind of like fangirling a little bit where you're like, okay, reel it in.
Oh no, I'm fangirling when they come in because I'm just like, God, can I go up with you?
If I was ever on a movie set or like a TV show like The Pit, like, yeah, I'd love to play a nurse, but like I kind of would love to fly in as like the flight nurse
or like
a flight medic.
Absolutely. Sign me up for any of it.
I kind of want to wear the jumpsuit.
That's it. That's it.
Take my helmet off.
Just have your hair go in the wind and know that you just darted someone's chest and saved their lives on the way, on your short little drive. And they call report and it just sounds so effortless. Like on the radio when they call in.
They're like calling in from flight whatever.
Yeah.
I'm in the sky. I'm in the air. Well, I've done all this shit.
Yeah.
I'll tell you the rest when I get there. You're like, got it.
Yeah. You don't ask questions. Sometimes you do. I got one just the other day that was like, this is so-and-so. We have I don't know, they give you like the exact ETA. So it's like, we're going to be landing at 12:49.
Clear there.
Yeah. Clear the helipad. We have a 30-year-old male. We just darted his chest and intubated. I can't talk anymore. Clear. And I'm like, okay, I won't ask you a singular question.
Right. Let's roll out the red carpet.
Love it.
I know.
And then we have ICU nurses who we have mutual respect for.
Totally. I think ICU is similar to, what did we say, like Peds, where there can be an array. Like, yes, there's a stereotype, but there can be an array of people in ICU. But we have a huge mutual respect for ICU.
100%.
But there is this like lifelong like beef, if you will, between ER and ICU, because it's kind of like,
well, the ICU doesn't feel like ER is critical care. And I think our beef with it is that the ER takes care of the ICU patients until
they come
there
in
is a
and
bed
we
ready.
Stabilize them, and then they go to the ICU. Do we manage them as well?
Absolutely not. No. And we will I don't think, I mean, maybe there are some ER nurses that say that they're managed well in the ER. They're not managed how they would be if they were in the unit.
Never as well as in the unit, for sure.
But I think the reality is that we have
part of that's environment.
Yeah.
Like,
I mean, we don't
we're
have all
not
the same
ICU,
things.
Yeah.
But the ICU nurse too is like very type A, in my opinion. You have to be.
I would say usually ICU nurses are very type A.
I also feel like ICU nurses are a little bit cold.
They can be very cold. I had an ICU nurse train me in the PACU, an old ICU nurse trained me in the PACU. And coming from the ER, like, we just had very different like habits. And even just like the charting, the nuances, like very specific, no, do it this way. And it was like a little overwhelming because I'm like, that's not how my brain works, but okay.
We're a little bit more spastic, I would like to say. I feel like the environment to be lights down low, maybe a little bit of music on in the background. Everybody is vented and sedated, which is, I think, how they prefer it. And they can be
Q1 hour charting. They like to fill everything in.
But they are cold until they come down to the ER. I feel like when an ICU nurse to float, I feel like when an ICU nurse comes down to the ER, it breaks the mold for that nurse. They then go back to the ICU and are like, I get it.
Yeah. I mean, kind of like, I think if we float up there and we're like, okay, this makes sense, similar. But I do think that most times they have floated down and they're like, what the fuck is this?
I mean, how can they not? But it's also the same
They're
when
like,
I
can
go.
you guys be quiet?
No, we cannot. We're going to yap all day. But also when I go up there to drop off patients, I instantly feel a little uncomfortable. And I think it's just because the environment is just so outside of my comfort zone. It's a little too calm. It's a little too quiet. Like I don't feel comfortable in the ICU at all.
Yeah.
And I feel like they're staring at everything where it's like,
Well, they're
I did my
so
best.
here's the thing I'll say. I thought I wanted to do ICU like out of nursing school. So I did my preceptorship in the ICU.
you have too vulgar of a mouth.
I don't know. Some of them are pretty vulgar.
You
too.
think so?
Yeah. Once you get to hang out and like talk to them on shift, I feel like they're just as vulgar, but they're a little more like stoic.
Okay.
You know what I'm saying? But I worked I did my preceptorship at ICU, and I remember being just like in awe, like sitting in huddle every morning because I was like 7A to 7P. So every morning, everyone like gets their assignment and they talk through really quickly all the patients on the unit, what's going on, like down to like the labs and like the metabolic stuff happening. And they're just like spitfiring. Like, and I remember being like, I would need like 20 minutes to look at my book, to like look up some of the stuff they're talking about, to understand like how they are understanding this. But it's like, they're so smart and they know so much.
About so
And
much.
I remember asking my preceptor, like, I just want to be at the place you're at where like you get a patient who's sick and has all this going on and you just know like what's happening in their body. Like
what's
you can,
the priority at that
and,
time?
And even just like the pathophys of it is insane. The level that they understand and know. Like,
and here we are in the ER.
Like, we know just enough to be
Well,
like,
but it's also
that
like
checks.
Their reports in the ICU are insane. Ours are like, well, we got it. Why don't you just go home and get some sleep? Like, I'll read the chart.
Yeah. Well, ours is very focused. We're like, they're like, let's talk about every system in their body and how it's been affected. And also by the time they've been in the ICU for days and days, like they do sometimes have a lot going on.
I feel like ours too are like, they have abdominal pain. They haven't shit in 2 days. Enema's coming up.
20 gauge in the right AC.
20 gauge right AC. Families at bedside.
Waiting on CT.
Yeah.
Bye.
Done. That's the difference.
Yeah.
Speaking of ER nurses, our stereotype is my favorite stereotype. Obviously, I'm biased with that, but
Of course.
it is the rodeo of the hospital.
It is.
But there are a lot of different personalities that work in the ER as well that I think people would be surprised about.
But you have to also like think of it this way. Every patient, whether they're an ICU patient, a Peds patient, a psych patient, wherever they end up, and they end up in these units with these nurses that fit those stereotypes, they all start in the ER.
Mm-hmm.
So you have like these personalities taking care of all like the starting. We're on ground zero here.
Totally. That is why I think it's the most fun place to work, really. You have no idea what's happening from day to day. You have no idea what's coming in next. You literally are flying by the seat of your pants for your entire 12-hour shift with literally everything being unknown.
Mm-hmm.
And it's fun. But you also work with a bunch of people that are like ready to get down at any time. These are the people that probably were the life of the party at one point in their lives and kind of bring it to the ER, in my opinion. Everybody has something to talk about. We kind of all get along for the most part, I would say. It's just kind of a good time. But we do know just enough to get by about every little thing.
What's the saying that ER nurses know a little about a lot of things, whereas like
ICU nurses know a lot about a lot.
Yeah. Yeah.
I mean,
yeah, they know everything.
Yeah.
Okay. I thought it'd be really fun to list off some current day celebrities and based on our own preconceived stereotypes of like nursing specialties and try and guess what we think their specialty would be.
I love this.
Okay. So I wrote some down.
Okay.
I already said who I think they are. I want to hear like just like rapid fire.
Okay.
Who, what specialty you'd put them in.
Okay.
Taylor Swift.
NICU.
I said Peds.
Ooh. Okay. So similar.
Similar. The Rock, Dwayne Johnson.
Oh my gosh. He's ER.
He's ER. Those muscles.
Through and through. Although I don't think he's getting his tailored. His figs aren't being tailored.
I don't know. They have to be. He's so big.
Well, maybe for that reason.
Snoop Dogg.
Oh my gosh.
We didn't talk about this stereotype. What I think.
Okay. We didn't talk about this stereotype. Okay. Snoop Dogg Snoop Dogg gives me like rehabilitation nurse, like not in a like
sniff?
a methadone clinic.
I put home health.
Oh, okay, I can see him. I can see that. Like wheeling up to a house.
Just rolling up.
Yeah.
Okay. Kim Kardashian.
Aesthetics.
Through and through.
You picked the same?
Through and through.
Okay.
Yeah. Gordon Ramsay.
Oh, like Chef Gordon.
Chef Gordon Ramsay.
He has like very good attention to detail. I do ICU for him.
I did too, but what kind of ICU? I have the specific ICU.
Cardiac.
I did trauma ICU.
Okay.
Similar. Reese Witherspoon.
Oh, she's Peds or NICU.
So I did NICU for her.
Okay, so we're just swapped.
Same.
Yeah.
Swap. Cardi B.
She a gangsta. Okay, Cardi B is Psych.
I did ER.
Okay, yeah, I forgot we haven't done ER yet.
Yeah.
She would thrive in either.
No, we did The Rock as ER.
Yeah.
But Cardi B,
She fits right in too.
yeah,
And a good time. She'd be a good time.
she'd be a great ER nurse. I could see Psych too, though. Gwyneth Paltrow.
Gwyneth Paltrow. Okay, so she's like clinic to me.
She's like a holistic. I did palliative care.
Oh, she'd be great at that. Very nurturing.
Very nurturing, holistic.
Yeah. Empathetic at the end.
Mhm.
Yeah.
Is it Killian Murphy?
Who is that?
Killian Murphy. Do you watch Peaky Blinders?
Okay, yes. The main guy?
The main guy.
Okay, so okay, yes, I'm on. He might be Psych to me.
I have him as Psych.
Mm-hmm. He seems kind of like serial killer vibes to me. It's the eyes.
It's the eyes.
And
it's
the
like,
cheekbones.
It's like the withdrawn, kind of quiet.
Yeah.
Yeah. Yep. Sabrina Carpenter.
Oh my gosh. Sabrina, please.
I have her as PACU.
Do you? Okay, I wouldn't have thought that. That wouldn't be my
Okay.
first. I pick Sabrina, kind of similar to you. And the only reason I picked this is because I think she'd be like a circulating nurse or OR.
Like in the OR.
Yeah, but that's the only reason I picked that is because the OR plays such good music sometimes
True.
that I feel like maybe she could be making the music for them.
Yeah. Fair. That's a good outlook. She was my last one I had down.
I loved that.
I know.
Okay, but I also want to know if you guys think that any of those are off.
I'm sure that people have different opinions, but I
I
feel
know,
like
I
we
love
were
it.
pretty, and we almost matched on all of them.
We did. So
Very similar.
I know. I just wonder if the nurses in those specialties
Agree with our
Yes.
stereotypes.
Yes.
I mean, you have to remember we are nurses, but we're ER nurses. So
we have no idea.
So do our stereotypes match
Yours.
other specialties?
Yeah, I
ideas of
love it.
stereotypes? Yeah, let us know.
Okay, this was so fun. I love doing this. I feel like we could talk about stereotypes all day long, whether it be from like docs like we've done or nurses. But Carly's having friends over for dinner tonight.
Yeah, I got to skedaddle.
My kids are literally slamming the doors right now. Can you hear them? They just got home from school. So this is like parenting fully taking over.
Yeah, it's time to move into our next job.
We're just two working ladies over here. What can we say? But I hope you guys enjoyed this one and tune in next week for another super fun episode.
See ya.
Bye.